Hi, my name is John. I decided to do my persuasive speech on universal healthcare in the United States. I don't know, have any of you found yourself avoiding going to the doctor or the hospital when you probably should because you're afraid of the exuberant amount of doctor bills, or this is the unfortunate reality of our system that needs to be fixed? I have a quote here by Walter Cronkite, and it says, America's healthcare system is neither healthy, caring, nor a system. And it's something that kind of hits home to me because it's the unfortunate truth about the United States and our healthcare. Um, I believe that our medical pharmaceutical industry in the United States is far better than some, but it's extremely mismanaged from a government level, and it has become financially out of reach for most people. Treatment coverage, there's varied forms of that, but I believe universal healthcare is the way to go, and not necessarily a single payer system, but a multifaceted approach to it. I'll be giving an overview of the healthcare system based on my research, and I'm simply explaining the concerns and the possible ways to improve our system in the future. My presentation will have an overall comparison of the universal healthcare system and the system that we currently have, the declining healthcare statistics, the U.S. healthcare plans and industry dynamics, pharmaceuticals, the politics that are involved in that, the benefits of our current system, and how the universal healthcare system would make it even better, uh, the history of healthcare and how we got to where we're at, and a progressive plan to how we can move forward in the future. Um, univer- Universal healthcare is basically defined as all the people have access to health services they need when and where they need them without financial hardships. It includes a full range of essential health services from health promotions to prevention, treatment, rehab, and just definitive care. So I'll start off with the statistics. So the top three wealthiest countries in the world use universal healthcare, and the U.S. falls in last place out of the top 10 in the world in qualifying healthcare. The U.S. spends actually twice as much on healthcare per capita than any other country, and we're falling at the bottom of the pack as far as quality and access. The universal healthcare system would allow quality care to all citizens at little to no cost and would be taken out of income along with taxes. Following the alarming rates of healthcare in regards to other wealthy countries, this leads me into some of the statistical data. The life expectancy is 77 as of 2020, and it has been on a continuous rise up until the last 2 years, which is a big part of COVID, but also accessing resources and doctors that are being overwhelmed in the current time. The average death rate is 73.71 as of 2021, which is actually going down um, as far as a steady increase until this current time. The average burst is 3.66 million, which is dramatically lower than it has been in the last 40 years. And that's a combination of economic change and also the healthcare system in general, just the changes and the cultural shift as far as our society. Deaths per year is currently at 2.85 million, which is on a continuous upward hill climb compared to 1980. And that's a lot to do with the population, but as far as our healthcare system just not being able to access it, and COVID also has a big part in this as well. Um, why universal healthcare is better with these statistics. So, more government funding will allow for more resources such as medical equipment, staff, and more money to train these employees to provide better care. Healthcare um, will allow those to not, this will allow healthcare to those that can't afford it, that can't afford private insurance. And the universal healthcare system will also reduce cost of total contribution due to more people being able to contribute to the big picture financially. Aside from the issues with our current system, I'll go into detail about the different forms of coverage we currently have. So, Medicare is overseen by our federal government and is normally dictated by age. Medicaid is overseen by each state and based on income. Employer provided would be the insurance that your employer offers to you, which you can either accept or decline, and you normally have different levels of insurance that you can choose from, which would be like an individual plan. So as far as universal healthcare, there's different forms of that. So there's a single payer, which is paid for by income tax, and every citizen is granted the same care, which is similar to what Canada is using right now. Mandatory health insurance, which is funded by employers in those countries that are currently using that, which is done by payroll taxes. And then national healthcare, which is the one that I'm a fan of, that I think will be more beneficial to our people. And that form is each citizen is required to contribute an overall coverage of the whole population. So physicians, medical professionals would be working in a private sector capacity. Um, and the pharmaceutical industry also has a large impact on our healthcare costs and to help our people. So the pharmaceuticals and politics involved in the private insurance industry. In 2021, the US distributed $560 million dollars in prescription drugs. So even though the US holds 5% of the world's population, we consume 50% of the entire world's drugs, which is quite alarming. And this is a problem, and we need to do something about that. And a lot of this has to do with the politics involved and the fact that these pharmaceutical companies are getting so much money based on the kickbacks of these sales. So, due to our free enterprise market, the pharmaceutical industry is extremely lucrative, and this gives incentives to doctors and prescribers to suggest more medication to patients from big pharma. And the US government started cracking down on prescription drugs with the rise of opioid deaths in 2012, which started in the 90s. And they did this by putting tighter restrictions on dosages and amount per individual. Universal healthcare will help these numbers by um, allowing the government to control the healthcare system more, and they'll be less likely to spend unnecessary funds, and will keep closer tabs on treatment and prescriptions. And I also wanted to add that currently Mark Cuban is an investor and a part owner in a pharmaceutical company that provides generic medications to the people at a fraction of the cost, like insulin medications, high blood pressure medications, and in some cases it's 200% cheaper, just because it's not based on such a big income revenue generator and more of a service to the people. And the pharmaceutical industry has become a monopoly, which has drove a lot of people to poverty. And the positives of our system are, along with the pharmaceutical industry and universal healthcare, and how we can improve those efforts. The US has some of the most advanced technology and research in the entire world. And being one of the wealthiest countries in the world, we do have a strong financial backing to support our citizens. I believe it's just, it needs to be allocated differently in order to um, better service our people. Our medical professionals undergo extensive certifications and continual training to ensure qualified and professional staff. um, Universal healthcare is very progressive, and it'll allow all citizens to access healthcare, not just individuals that can afford it or qualify for free government funded healthcare. Um, with everyone taking part in this system, hospitals and physicians will have a bigger funding pool, so to speak, instead of treating people in need with no insurance or pursuing collections to receive payment, which actually ends up costing the system even more money and raising insurance rates. And um, now that I've described the dynamics of our system, I'll go into what led us to this place in healthcare. So, a little bit of history, going back to the 1800s. Healthcare actually originated with logging companies in the 1800s, and they would subcontract physicians to look after their workers. In 1929, Baylor University began offering healthcare to their teachers, which was the start of Blue Cross Blue Shield. In the 1940s, President Truman introduced universal health care as a proposed solution to economic downturn preceding the Great Depression. In 1969, President Kennedy implemented the Medicare system that is still in use today for the elderly, and that's something that we all currently pay into, similar to universal system, but only for the elderly. In 1993, President Clinton introduced a single payer form of universal healthcare, and it didn't stick. And a lot of that was because of the raise in tax rates, which I agree with. And I think the average population doesn't want to pay higher taxes. Um, but at the end of the day, we're going to have to pay for it somehow. And instead of all contributing, it ends up costing us in the back end. And Also, in 2010, President Obama implemented the Affordable Care Act that reduced costs of the underinsured and people with pre-existing conditions, which is still in use today, which I believe is a step in the right direction and a form of universal healthcare in a way that can be modified to better suit our system. Um, in the National Health Forum, as you can see, many leaders have tried to implement some of the universal healthcare, and it's normally brought up to the political table in a form of a single payer system, and it normally fades out and goes back to the private market just because of supplemental care and the cost and the tax rates of that. A two-dimensional system would allow a minimum level of care that would be sufficient and a choice for a higher level of care if you can afford that and want to go that direction. The single payer system has had difficulty sticking with the public, but I think it just needs to be adjusted and in a way that is more easily understood to where the tax rates aren't as bad. Um, and as far as moving forward, our healthcare system is operating at some of the highest level. We have some of the best training, equipment, and funding in the medical field in almost any other country, but we're falling at the bottom as far as access and quality. So how can we improve? The benefits of our government-run universal healthcare would be an increase in funding that would help develop more telehealth and home services to treat more patients at home, so you can access more people and provide services to more people instead of sitting down in an office. The universal system will also broaden the available practitioners since they will all end up charging the same system, easing the load on doctors and providing more care to citizens. The increase in funding will also allow resources in the form of personnel, equipment, and training, allowing a higher level of care for available services. Universal healthcare also works in other countries, but there can be different variations of it. The drawbacks of it, this can be the quality of care and long wait times for treatment. But if we allocated the funding and introduced a small tax to provide more resources for a basic level of care, we would have sufficient staff and medicine to accommodate the public at a minimum level with the availability to pay more for higher level care or cosmetics things. Throughout this presentation, I went into detail about the positives, negatives of our healthcare system, the alarming statistics, the history of healthcare, and why I believe the universal national form would work for us and is the direction I think we should be going. The purpose of this speech was to explain the dynamics of our healthcare system and the ways we can improve it. I'd also like to hear the feedback from the rest of the class and what your experiences it is with insurance and healthcare and medicine, because I know some of you are also getting into the healthcare field. Um, Today, I gave an overview of our healthcare system and the way that we can improve it, especially just as a whole. So please share your thoughts and opinions after this speech, and I'd love to converse with everyone. Thank you for the opportunity to speak, and I hope